series. I appreciate you taking some time out of your busy schedules to join us this afternoon. My name is Steve Kessler with Vertical Alliance Group, and I'll be hosting the webinar. We've got a great topic today, what you need to know about the new certified medical exams, and based on the number of registrants, I think it's a topic that's important to everyone. Before I introduce Dr. Shirley, who's our guest and a registered medical examiner, a couple of housekeeping items. First of all, a brief commercial about our monthly trucking business boot camps. Some of you may have attended, some may be familiar with it, but I wanted to let you all know that the next program is April 7th and 8th. And essentially we'll talk about our learning management system and how that can help you improve safety and reduce accidents, help you reduce orientation costs, improve CSA scores, improve fuel efficiency, and other operational costs that seem to be rising every day. So if you have an interest, go to vagbootcamp.com/agenda, and you can learn more about the program, and there'll be a link there where you can register. A couple of things before I turn it over to Dr. Shirley. The webinar is being recorded, and we'll be following up with an email after the webinar, probably will be tomorrow. You'll receive a link to the recording, so you'll have an opportunity to listen to the material again or share it with those that couldn't join the webinar today. Also, I need to let everyone know that because of the large group that we have today, everyone is muted, and we can't hear you. So you have the ability to type in a question on the little panel on your screen. So anytime during the program, if you have a question for Dr. Shirley, please feel free to just type that in. I'll see that here on my side, and we'll pose that question to the doctor, and he'll do his best to answer your questions. We'll try to keep the program to an hour, so any questions that we don't get answered, those are logged here, and we'll follow up with you after directly to make sure that we get everyone's questions answered. And also, I need to let you know that in the email that follows, we'll also include a copy of the slides that are going to be used today, just so you have those for your reference and for some contact information. So without further delay, let me introduce everyone to Dr. Jeffrey Shirley, and I'm going to turn it over to you, Doctor.
Steve, thank you so much for having me on today, and I just want to thank Vertical Alliance for having me here so I can give you a little bit of information about the new certified medical examiners. Just want to tell you a little bit about myself. As you can see, I am from Alabama. I was born and raised in Alabama. My dad was a preacher. My granddad was a preacher. My great-granddad was a preacher. And so at the end of this webinar, we're going to have a PayPal offering plate that we're going to go around so that we can all offer a little bit of. But I was born and I came to Texas in 1985, and I went to Texas Chiropractic College, and I graduated in December of 1988. And I've been in private practice since 1989 all across Texas. I've been here in Dallas for the past 2 years, and I work at the Body Shop Chiropractic in Dallas, Texas, in downtown Dallas. About 2 years ago, I was introduced to a Dr. Michael Booth, who we worked with at another clinic, and Dr. Booth was the certified medical examiner for Mobile Medical Network, who did medical exams for Conway Trucking, Werner, and International Schools Trucking. And he decided that he wanted to take more of a retirement type situation, and he asked me if I wanted to come in and do the exams. He was going to be moving out of town, so I decided to come in, not knowing a lot or too much about the DOT examinations. Well, I can tell you one thing. I was well trained over the time that he was with me for about 3 to 4 months to really get me set up for the training, the certified training that all CMEs have to go through, plus the test that I took. And without his training, I really don't think that I would have done just as good as I have done. over the past year, or I checked on the National Registry yesterday, as of July 1st of 2014, up until yesterday, I've done over 2,300 exams, and I started back in November of 2013, so you can add that, so it averages over well over 3,500 exams. I took my training, which was a very intensive training, in April of last year, and I passed the test in April of 2014. Next slide. So basically what I want to talk about today is a little bit about what the National Registry is and what it's involved with a doctor becoming a certified medical examiner and what is required of him more than anything else. It says the National Registry of Certified Medical Examiners is a new federal motor carrier safety administration program where all commercial drivers whose current medical certification expired on or after May 21st, 2014, at the expiration of that certificate must be examined by a medical professional listed on the National Registry of the Certified Medical Examiners. And only medical examiners that have completed training and successfully passed a test on the FMCSA physical qualification standards will be listed on the National Registry. There is a complete guide on the National Registry of Certified Medical Examiners website that you can go through. The type doctors that can be on the National Registry are MDs, DOs, DCs, nurse practitioners, and PAs. All of these are certified as a medical examiner if they follow through the training and they take the test and pass the test itself. Next slide for me, please. So the National Registry of Certified Medical Examiners, really I went through the whole final rule, which was about 40 to 140 pages, and basically I got just the bits and parts of what a certified medical examiner is supposed to do. It basically ensures the medical examiners sufficiently understand how the FMCSA medical regulations and guidance, related guidance apply to the CMV drivers. Now I do understand that there's been a lot of DOT examiners who've been doing these examinations for a long time. The final rule began in 2012, and it was required to have a specific amount of knowledge. It had to have what the physical qualifications and exactly what the driver, what his mental, physical, and emotional abilities were in driving the truck, and we had to know really a lot about that aspect. Next slide for me. So it was also created to enhance, and this is what the word I like to use more than anything else, is enhance the CMV drivers' health and reduce highway crashes. So the information from the NTSB crash investigations indicates improper medical certification of CMV drivers with serious disqualifications, medical conditions has directly contributed to fatal and injury crashes. A little bit later on in the webinar, I'm going to give you some of the main ones that I have seen and that I go through that would tell me, you know, this particular driver is not fit to drive. Slide. So the medical examiner must be aware of the rigorous physical, mental, and emotional demands of the driver, exactly what he does in the drive. The med examiner is required to certify drivers that do not have physical, mental, or organic conditions that might affect the ability to safely operate a commercial motor vehicle. When it basically gives us the opportunity as a certified medical examiner to be fit to drive, that is my focus in every single driver that walks in to my examination room, fit to drive. Not just physically, not just mentally, not just emotionally, but all of these. Because we know that each of these guys that come in, usually come into my office or come into my examination, are very, very scared of a doctor. They're scared of their examination. They're not sure what we're going to do. They have a lot of, it may be a new job, it may be a new certification. They may have just had a fight with the wife. They just may have had some type of situation. There's a lot of things that go on with their mental aspect that you really have to understand when they walk in the door and be able to calm them down and be able to open up to you. Because most of the time in the medical form that they fill out, a large portion of them do not tell the truth. They just mark everything no, and basically now it's the doctor to find out. And if the doctor is not asking the particular questions that he needs to ask, he will never know, and he won't find out. Slide.
Quick question, Dr. Shirley.
Sure.
I think it's a good time to address this. Someone is asking, what's an organic condition?
An organic condition is any type of genetic type condition, organic or genetic.
Okay. All right. That makes sense.
Genetic condition could be, it could be diabetes, it could be hypertension, but it really depends on, more of a serious type of illness that you normally wouldn't see in just a normal examination itself.
Okay.
That makes sense?
Yes.
Okay. Next slide. There we go. So, as you know, as of May 21st, 2014, all interstate CMV drivers must have their physical examination performed by a certified medical examiner listed on the National Registry. I think that all the people on the webinar are safety managers. They all understand this already. The safety managers that I work with specifically, they know these forms backwards, forwards, in and out, and they know exactly that each doctor that does these have to be listed and have to have their number, not only on the certificate, but also on the form itself. It also says the medical examiners must take refresher training every 5 years and take the certificate test every 10 years to maintain their certificate. So let's go to the next slide. So my question to most of the safety directors and how I can help you out more than anything else is, what type of medical examiner is doing your examinations? Is it on-site? Is it off-site? Is it at Care Now? Is it at Concentra? Is it an independent doctor? Someone who just does these on the side versus someone who does these full-time? I'd like to say that I do these full-time. I've done over 3,500 examinations over the past year. And letting you understand and know, say, how can I talk to this medical examiner about a particular driver, about a particular condition, just to make sure I understand what's going on. Well, what's real funny about this is the National Registry of Certified Medical Examiners, on their particular website, said in a rule by the federal FMCSA on 4/20/2012, which is the final rule, it says, we do not believe we should impose an additional burden on drivers by requiring them to be examined by medical examiners who do not provide primary care to them. FMCSA anticipates that requirements for medical examiners to be trained and tested in FMCSA standards and guidelines will result in more consistency in certification decisions among medical examiners. The FMCSA anticipates that MEs will be deterred from making driver qualification decisions that violates the FMCSA standards by provisions in the rule that will allow FMCSA to remove an ME from the National Register. Basically what that means is, if your certified medical examiner is not following the rules, he will be removed. But it's your responsibility to find out if he's removed, because he probably won't tell you. Simple and easy. It also says, in addition, we believe that employers should continue to have the option to require their drivers to be examined by an ME selected and or compensated by the employer, because they have an obligation to require drivers to comply with the regulations that apply to the driver. This option is permitted by 49 CFR 390.3. It's in the FMCSA guidelines, which states, let me quote, that nothing in the FMCSRs shall be construed to prohibit any employer from requiring and enforcing more stringent requirements related to safety of operation, employee safety and health. I know this is for a fact for the companies that I work with. I work with Conway Trucking, I also work with Warner Enterprises, International Trucking, I work with DART, and I also work with International Schools. And each of those have specific policies in their bylaws which require and tell me. For instance, if they have a new certification that comes in and the particular blood pressure is in the stage 2, which we're going to discuss in a little bit, and they're normally supposed to get a 90-day card or a 3-month card, then these people are temporarily disqualified until they get into the range that needs to be there. Also, with your on-site certified medical examiners, you have more conversation. You have a little bit. You can talk to the person. I know that I've talked with Karen, who works at DART, many a times regarding patients, regarding drivers who have certain conditions, and then I'll explain to them, here's what I feel, here's what I see, here's what I discuss. Also, in forming any type of opinion or any type of information about a particular driver, you know, as a chiropractor, coming into these particular examinations, I knew how to do the physical examination. That was easy. That was not very, very hard. Understanding more about the medications of hypertension, diabetes, gastrointestinal reflux disorder, circulation problems, anxiety, depression, PTSD, just to name a few, was really beneficial for me to have Dr. Michael Booth to really explain to me. And then as I saw these over and over and over again, I just did my own research through Hippocrates, through the internet, to understand what type of drugs these people are taking, how does it interact with all the conditions they may have, so that I can make a better decision to determine if the driver is mentally, physically, or emotionally fit for duty. And I feel a lot of times the primary care facilities themselves, if they go in and they have a particular blood pressure that puts them out of the range, that they just go ahead and give them a temporary disqualification versus maybe holding them over a couple of days because of maybe nerves. Maybe they just got off the road, they're dog tired, they can't focus, and I just want them to have a chance to determine that there's not a serious either an organic or genetic type situation, or hypertension that's not been shown, or something that maybe they've eaten wrong. Let me talk to you. These truck drivers that I've seen over the past year generally are very, very unhealthy in nature, and I'm going to go over some of the conditions I see. And it is their responsibility to eat the right things, to sleep, have proper sleep, to control their conditions, may it be on medication for hypertension or diabetes or thyroid or conditions like that. But it is ultimately their responsibilities. And sometimes their doctor, they may hear from their doctor that this is a serious condition, but they don't really get it until they understand that this is a part of their job. And I tell them, and when they come in, they walk in the door, here's what I tell them. You choose to be a truck driver. Is that correct? And of course they all say yes. You choose to be a truck driver. Okay? Did you know by the federal mandate of the Department of Transportation, you are mandated by federal law to stay healthy. And if you do not stay healthy, and you do not follow the regulations versus the guidelines, which I explained to you, regulations are things that are cut in stone. Guidelines are the opinion of the medical examiner that we see. If you do not follow these regulations, you will be disqualified. Even worse than that, not just being the disqualification, but the conditions that they have, they will die. Not just having the conditions they have, it will be a slow torture death. And it's a very, very serious thing that I try to get across to these guys very briefly as I go through the medical examination, because I feel that's my part to make sure they're fit for duty. So, next slide.
Let's pause just a second, Dr. Shirley, if you don't mind. We had quite a few questions that popped in, and that's excellent information that you're passing on here. I'm going to kind of start at the top, try to take these in order. One question was, and this goes back to an earlier slide, but would suspected epilepsy be considered under organic condition or mental condition or both?
Organic.
That's organic. That's okay.
Organic. And can I answer that question also?
Yes.
A suspected epilepsy first of all, needs to be diagnosed
Right.
by a neurologist to make sure there's no seizure disorder involved. If it is epilepsy, that is a seizure disorder, which will, of course, disqualify the driver. Okay.
Right.
When I see all my drivers and I have a suspected condition, I always refer back to their PCP or their primary care physician or their specialist for further documentation, medical records, further notes, and a letter that that basically states that they are safe to drive a commercial motor vehicle. So I don't just say, oh, you can't have it. I said, you need to go back to your doctor and get a more definitive diagnosis, because with the diagnosis of epilepsy, it is disqualifying. But if not, the medications may be.
Okay. All right. Here's another question. Can a driver have 2 consecutive 90-day cards?
No.
No.
According to the FMCSA DOT guidelines, they are only allowed one 30-day one 3-month or 90-day card for any condition.
Okay.
They cannot. Let's just say. Let me make it for instance. They come in, and this I've seen this before, and they come in with hypertension. They get a 3-month card, and of course they come in, if they're not within range, then they could not get another 3-month card. Does that make sense?
Yes, it does. Another quick question. What are the requirements for drivers who have been diagnosed with AFib?
Well, it's good that you asked that, because I just had a patient to come in, or a driver, excuse me. Driver can I kind of go back from patients and drivers. I had a driver just come in the other day, 2 days ago, and it was interesting that he wrote on his card that he had certain conditions, but he had AFib. And I said, now let me ask you a question. You just went to your certified medical examiner less than a month ago, and he certified you with a 2-year card. Is that correct? He said, yes. I said, well, why did he certify you with a 2-year card? Well, I don't know. He's the certified medical examiner. I said, according to DOT, he could not certify you for more than 1 year with a heart condition that you have. Secondly, did he request information from your cardiologist or your PCP regarding the condition that you had? He said no. I said, why didn't he do that? I said, that's a very, very, very serious condition that can lead to issues with racing heart. It can lead to problems such as dizziness, lightheadedness. In the certification course that we took, okay, the training that we took, I have a PDF or a PowerPoint presentation of 97 pages just on the different classifications of certification, what I need to have to write on the certified the certificate, in each individual condition, AFib, myocardial infarction, stents. I can't go through all of those particular situations, but AFib has a certain requirement that we have that needs to have an EKG, an echocardiogram, to determine if there's any damage to the heart, or if there's a condition which is causing this particular problem. Normally the PCP will put them on some type of medication, as long as it's not in the DOT guidelines that causes you to be disqualified for that medication, and they have to be on for a certain period of time. I'm not sure the exact dates, but they have to be on that and well maintained, and a letter from the doctor or the cardiologist in that type situation that clears them for duty, that says they are safe, they've been well maintained, they're asymptomatic, no pain, no chest pains, no conditions, no dizziness, lightheadedness, no headaches, nothing that would affect that particular situation.
Okay. Here's another question that kind of relates to what you've been talking about, Dr. Shirley. How is it confirmed that the employee has appropriately followed up with their primary care physician or completed a sleep study, for example?
I'm sorry, could you?
Is there a process on how it's confirmed that the driver has actually followed up with their primary care physician or completed? Is there a way to confirm that that's happened, or is that the responsibility of the driver and their employer?
So is the question related to sleep apnea? Or
not directly. It's just it says, how is it confirmed that the employee has appropriately followed up with their primary care physician or completed a sleep study?
Okay. Following up with, it just really depends on the condition itself. Your conditions such as hypertension, diabetes, all these other conditions, we leave that up to the driver. But in any type of heart attack, AFib, more serious conditions, we do require documentation from the specialist. If they are part of a specialist, whether it's a neurologist, psychiatrist, cardiologist, even orthopedic surgeon, that would give us clarification. It's up to the certified medical examiner if he feels necessary based on his exam from the driver. If he feels it necessary to get that documentation from the doctor, that's a part of his responsibilities that he does. Now, the sleep study may be a little bit different for the fact that it just depends on if he's already diagnosed with sleep apnea or they want to do the sleep study test. I'm not sure about the question.
Yeah, well, it's. I think you've answered it. It sounds like it's essentially kind of up to the driver to make sure that they've gone to their primary care doctor and followed up and done what they're supposed to do. Yeah, okay.
That's correct.
One last question, and then I'll let you move on. Somebody is asking if you know what is the regulation citation that prohibits consecutive 90-day med cards? Is there a point in the regulations you could point to, or?
I'm sure it's a part of it. I don't know specifically right on hand the exact page number.
Okay.
But it is in the FMCSA regulation form.
Okay. Okay. Well, we can perhaps research that a little bit and provide a little bit more detail about that. So, fantastic. I'll move on to the next slide. Thank you, Dr. Shirley.
Thank you. All right. Let's take a look. Check. Wonderful. So, some of the things that I deal with as a certified medical examiner of the drivers that come in to see me. I think that the number one condition, according to the FMCSA and from what I see, is hypertension. So hypertension versus high blood pressure. And because a lot of times the drivers will come in, I'll say, do you have hypertension? Well, no. I said, well, do you have high blood pressure? Well, yeah. So you have to really correlate. I try to give them a very, very brief answer of what the difference is between hypertension and high blood pressure is. And I tell them this. I'll say, high blood pressure is a fluctuation of your blood pressure on a daily basis. Whether you're driving in a truck, whether you're home, with your wife, with your children, money issues, stress, anxiety, whatever happens, there's a certain fluctuation of blood pressure. If it goes above the normal blood pressure, according to DOT's 140/90, we consider that pre-hypertensive. That is high blood pressure. If it comes down, we still have possibly high blood pressure. Hypertension is when the blood pressure increases above 140/90 and does not come back down. It stays above that. And that's what we're going to determine when we do these particular examinations. Based on the safety directives here, I'm not going to go through the whole phase 1, phase 2, phase 3, because I think they already know those particular regulations. But here's my situation when we're dealing with these guys coming in for their examination. As I said before, some of them just maybe they're new hires or they're rehires, and they were driven on a bus from Timbuktu, who knows where. And they just came in that night. They're tired, they're sleepy, new job, anxiety, maybe they had you have to look at all that aspect. And you can do it very, very, very quickly in your examination without having to go for 20, 30 minutes. I know some of the drivers love to talk too much, and we cut them off pretty quick, but also there's more of them that won't say anything to you at all. So they come in with, some type of hypertension. If it's in the stage 3 area, I basically ask them questions at that point. Are you dizzy? Are you lightheaded? Do you have any chest pains? Do you have any pains down your arm? Do you have any indigestion? Any belching? Any of the conditions that we relate to some type of heart attack? None. Zero. Zippo. So what we usually do is, according to the DOT, we are required to take 2 blood pressure readings. We usually try to do it within or 30 minutes apart. If they have the same or similar blood pressures, we usually try to hold them over a day because of the situation that they've been into. We'll wait for another day, and some of the places I go Monday, Wednesday, and Friday, so we'll do Monday and Wednesday, just to see if we can, have them maybe have a good meal, have a good night's sleep, understand what their situation is with the new company, going through the computer-based trainings, and just kind of get them to relax a little bit. If the blood pressure comes back at the same as they did when we first measured them, then we go ahead and we mark our cards accordingly. I know that when the drivers do come in, this is the biggest case of denial that I see in the DOT practice that I do, because every one of them come in and say, well, I don't have hypertension, I don't have that, my last physical exam didn't have that. Of course, then I look at them and their BMI is 47. They just had a double cheeseburger with a milkshake, a chocolate donut, and they just smoked a cigarette, and they're wondering why they have hypertension. Okay. Then also you have the ones who have genetic, who don't have those particular problems, but it's not fair, okay, that they do have those particular problems with hypertension. If it's genetic, if it's in their family, if it's in their ancestry, if it happens just to be a part of their life, it's not fair. But according to the DOT regulations, their blood pressure must be below 140/90 to recertify them, whether it's a new hire or recertification itself. If the particular driver comes in and he has a history of hypertension and he takes medications or no medication and he tried to control it with diet and he's above or in the phase 1, which is 140 to 159 over 90 over 99, then we give him an automatic 3-month or 90-day card. At the end of 90 days, he must get that below 140/90 before we can recert him. All the hypertension diagnosis, all the hypertension conditions that we see are not permanent. They are not permanent disqualifications. We're always temporary, and that's based on the company that I work with and how they want to work with that particular one. Usually, I don't know, sometimes within 30 days, maybe 2 weeks, depending on the policy of the company, that we can have that guy rechecked if he needs to get his prescriptions refilled, if he needs a follow-up with the medical professional for his hypertension. And just for myself, last week, I had 5 separate guys from all the different companies that I do certified medical exams with. All of them were in the stage 3 hypertension. And they all told me that their examination the week before was a normal blood pressure itself. So my situation with that is to err on the side of judgment. If you have an on-site doctor, if you have someone that you know that you can talk to about this particular one, I would get the re-examination or the examination whether he's had it the day before or a month before, because of the fact that these guys, all they want to do is get their card signed. And a lot of times they will not tell the certified medical examiner doctor the conditions they've had, and if it's an independent doctor that's just doing these exams on the side, he's not going to know the whole stipulations involved behind what is necessary to certify a driver for a 1-year, 2-year, or 90-day card itself. Also, so in talking about that, we're talking about diabetes. That's another condition that seems to be very, very high in what I treat or what I see as a certified medical examiner. A lot of the conditions from diabetes are genetic in nature. They are passed down from parents, from grandparents. It can be any sex or any race. I've seen them all along the line. And I tell these particular drivers with hypertension and diabetes. You know, we check out your urine, and we check out specific gravity, we check out glucose, we check out blood, and we check out protein in the urine. And if there's any glucose or sugar in the urine, we actually will do a random blood glucose study according to the DOT. We do a little finger stick. That finger stick, and most of the time it's a random because they've already eaten something for lunch or for breakfast, or they've had something within the last 24 hours, that level needs to be below 200 milligrams per deciliter. If they come up above that, normally we question them more, have you been taking your medication consistently? And by the time I get to that part, I've already developed enough rapport to the person that he's kind of letting go and saying, hey, I didn't take my medication, or I didn't have money last month for my medication. So we have to treat accordingly to that particular situation and decide what we want to do about certification or sending him back to his PCP for further medication or what needs to be done. If the driver is on medication and consistently, we usually wait a day, we hold them over, we make them fast the night before they come in, 6 o'clock the last meal, no food, water only. You come in, we do the finger stick, and it must be below 160. If it's not, you're temporarily disqualified till you go back to your doctor with your PCP to change, monitor, or treat your condition that you're having. And that's what we do for diagnosis. And I tell these guys, I said, these two conditions are the most serious conditions that we see. It's a silent killer. These silent killers, and it's so funny, they come in with hypertension and diabetes. And I look at them straight in the face and I say, how do you feel? I feel fine. I don't feel any different than I felt the last 5 years. I said, well, you have hypertension and you have diabetes. These conditions can cause heart attacks, they can cause strokes, they can cause lots of strain and stress on your body, which will affect your ability to drive over the long haul. So also, it's a high heart attack type situation. You have a heart attack in the truck, you're going to die. And if you don't, it's going to be a very, very, very hard recovery period. And you are going to possibly kill a bunch of people in the truck that you're in, putting a liability to you and your company and a lot of different things. So we want to make sure that these guys are taken care of. Just a story real quick about a driver that did come in. He came in, it was probably last year, and we took his blood pressure. He was a rehire for a company, and elderly fella, probably not elderly because I'm close to his age. He was in the 60s, and we took his blood pressure. It was within normal limits. I mean, it was below 140 over 90. He had a good blood pressure, good pulse. His examination passed. I think he did have a condition of hypertension, so we did put him on a 1-year card and sent him off. I think his blood pressure was 128 over 84, right, roughly around that. Very, very good coverage. So basically I went out, and about 2-3 weeks later, the safety director came to me and he said, hey, you remember that guy so-and-so that you saw about 2-3 weeks ago? I said, yeah. He said, well, about a week ago, he had a massive heart attack. He was driving his truck out of Plano. I live here in Dallas-Fort Worth, or DFW, and Plano's a little bit north of us. He's driving his truck out and had a massive heart attack. I said, oh, my goodness, did we miss something? He says, no. He said, this guy was a rehire. He tripled up and quadrupled up on his medications to get his blood pressure down so he could pass his card. Simple. These guys are going to try to do anything they can do to try to get their cards passed. And after that happened, it really made me seriously talk very briefly, very quickly, about the dangers and seriousness of hypertension. Right. Next one we talk about is obstructive sleep apnea, and this is probably one of the biggest ones, and probably why a lot of people came on this particular call, because they want to know, right, what's the new thing? What's up with the sleep apnea? What's going on with this? According to all my research, as of today, it's still a option, or it's an optional treatment or optional testing for the truck driver. He has a choice. But let me explain and let me go into depth of how we do this type of situation. Each company which I work with, and I agree 100% with their policies, is if I feel that a sleep apnea study should be administered, okay, and I recommend it, then I can give that particular driver a 90-day card until he does that particular test. How do I determine if a driver has sleep apnea? Well, first of all, we have a stop bang questionnaire form that I believe that you can download from the FMCSA. If you don't, Steve, I'll put that on the documents that we can send to them. It's an eight question questionnaire. Okay, it's real simple and easy. They answer 5 of the questions, but 8 of the questions, or 3 of the other questions, are questions that we answer ourselves. And they ask questions like, do you snore? Do you stop breathing at night? Does someone notice you stop breathing at night? Do you smoke? Are you hypertensive? Some of the questions that they can answer. So when they come in, usually in my particular, at one of my facilities that I work at, it is the hub for the sleep apnea studies. So they all come in, every one of them come in, and it says sleep study on their form. So first question I ask is, so do you know anything about sleep apnea? And they say, well, no, but the other doctor said I'm overweight, I got a big neck, and I got sleep apnea. And I say, so that's what exactly they said, you have sleep apnea. Okay, and the first thing I say is, you know, to determine if you have sleep apnea, we base it on certain criteria, okay? To give you a diagnosis of a condition without a test, without a discernible, proven test, is malpractice, first of all. They can't tell you have sleep apnea. Now, they can tell you you're qualified for the sleep study, but they can't tell you have sleep apnea. Right. So we base it on 3 or 4 different criteria that I look for. One of the criteria is the body to mass index, the BMI. It's a height versus weight in a ratio type situation developed by the federal government many years ago that actually tells me, because of the BMI, that I'm overweight. Well, so are most of the truck drivers we see out there. If the BMI is above, we go by 33 to 35. If they have a neck size, males above 17 inches, females are below 15.5 inches. A Mallampati class. A Mallampati class is the thickness of the tongue when you look in their mouth. It's in 4 classifications. The first classification is the thinnest part of their, if they open their mouth and their tongue is very thin, where I can see the back of their throat, the uvula, the tonsils, I can see everything, it's a class 1. Class 2, their tongue is 25% thicker. Class 3, their tongue is 75% thicker. Class 4, I can't see crap in the back of the throat. There's nothing there. And normally in a 3 to 4 classification, plus neck size over 17, plus a BMI over 35, I will recommend to the patient or to the driver a sleep apnea study to determine. And I tell them basically they can put leads on your forehead, they're going to put a strap around your chest, they're going to check your heart, they're going to check your breathing, they're going to check your nerves as you sleep at night to determine if you have sleep apnea. And if you do, you know, basically there's a CPAP machine that's necessary, which I'll go over in just a second, which basically is necessary for you to keep using your license. And according to the DOT, the CPAP machine must be used 70% of the time at 4 hours or longer. But here's what I tell the drivers about the sleep apnea. And I said, and here's what we want to determine if you have a diagnosis of sleep apnea. Sleep apnea is an obstruction of the airway when you sleep at night. When you lay down on your back or on your side when you sleep at night, your body compresses, the tissues compress, which could obstruct the airway that you sleep with. If this happens, you sometimes snore, not all the time. You sometimes stop breathing, not all the time. But we don't know, but it does affect your heart, it does affect your lungs, it affects your organs, your tissues, your arterial flow, it affects the oxygen content through your body. Bigger things, it can affect your hypertension and make it worse. It affects your diabetes, makes it worse. Also, it can actually affect any type of heart condition you may have, or cause some, or not cause, but affect some hearts, like AFib, like one of the safety managers asked earlier. But the biggest study that I read was about 2 months ago, and it said that undiagnosed sleep apnea for longer than 10 years is a precursor to dementia. Precursor to dementia. Everyone knows what dementia is the oxygen in your brain, you're losing brain cells in the memory and the things that are gone. Normally when I tell the driver that they basically, that this particular study came out, every one of them say, let's do it. Let's do the sleep study. Yeah, I used to have a problem with getting them to do it, but now it's like, here's what we got. 10 years undiagnosed sleep apnea can lead as a precursor to dementia. And that's probably the serious type situation that we can look at. How is it affecting the driver over a course, over the first 10 years? And that's what we have to look at with obstructive sleep apnea. Obesity, we know this one. I think we all know this one, and this is probably one of the things that probably causes or it makes obstructive sleep apnea worse. It makes diabetes worse. It makes hypertension and high blood pressure worse. And getting them to follow a weight management program or a lifestyle change has been my biggest concern for the course of the past year and a half that I've been doing DOT exams. I still work at it. I still try to the best I can. If they get to a point where they're over 450 pounds or 500 pounds, I do recommend that they do advise them to seek their primary care physician for medical treatment of weight loss, whether it's a gastric sleeve or bariatric type situation, because they're not going to be able to do it on themselves or by themselves based on my experience of what I've seen. So it's a big, big condition that maybe some of the safety directors or some of the people out there need to really concentrate or make it a policy, and this is my opinion only, I'm just giving you my opinion, that maybe could make a policy that, and I did see one company that did that, that if they have a BMI over 35 or 40, that they actually, instead of getting a 2-year card with no health conditions, no hypertension, no diabetes, no other organic type condition, that they can give them a 1-year card. They give them an incentive to start losing the weight. And I think that would probably help. But it just takes the driver himself motivated, that he decides he wants to do it. He prepares himself to do it, and then basically he's committed to doing it himself. And of course, the last condition that we're going to deal with is anxiety, depression, or other mental condition. I think we all know about what just happened here on the German Wings plane in France, about the co-pilot that had a diagnosis of depression. And it said that he hid all this information to his medical examiner. Though he was taking injections by his primary care physician, he still hid all these conditions. I don't blame the medical evaluator per se. I do blame the pilot if all these stories are absolutely true. But it just goes to show you what a driver, an airline pilot, but mainly in our particular situation, a commercial motor vehicle driver will do to get his card signed. And we want to try to help. We want to try to know more about, and it doesn't have to be a full 1-hour exam on each person. It just takes a few questions. And if the doctor is very eloquent in his speak, and is very eloquent in understanding the little signs that these particular drivers give to you, I've pulled out more things than you've ever known from a driver in less than 2 or 3 minutes that the other certified medical examiner missed. Do I miss things? Yes, I do. I'm not perfect. But I do try to understand the whole mental, emotional, and physical aspect of what these drivers need to be doing to be fit for duty. So, next slide. Let me see.
I think that's the
okay, that's my last slide.
So we got quite a few questions here.
Go ahead. So let's get the question. Let me end up real quick. Like I said, I just want to tell you, Steve, thank you for allowing me to give you some information. I mean, each of the conditions I talked about, I could spend an hour on. I could tell you stories. I could give you information. I could tell you about all the different conditions, and just really go through a process of that. But I myself, I like to. I know we got about a few minutes for this. I like to, take the command of, love the Lord with all your heart, your mind, and your soul, and love your neighbor as yourself. And I try to inspire that to be truthful, to be respectful, and to be honest to every driver that walks in the door. So I'm ready for questions if you got them.
That's fantastic. Yeah, we have several, and as you might guess, there are quite a few here that relate to sleep apnea, but I'm going to kind of bounce up here towards the top just a little bit. Someone's interested to know what percentage of your examinees get a 2-year card, what percent get a 1-year card, and what approximate percent do you see unable to get a card? Have you ever kept any stats like that?
On paper, no. In my mind, from basically the ones I see, I'm going to say about 60% get a 2-year card.
Okay.
Roughly 35% get a 1-year card, and then the last percentage is either 90-day or temporary disqualified.
Okay.
That is a rough estimate. That's not. I didn't go to Ernst & Young and find the research or anything like that. So
I got you. Okay. One thing I'll throw in here, we were talking about a regulation about the 3-month medical card, and somebody's actually checked into that. Thank you, Sarah. She said that the regulation for the 3-month medical is 391.43 under blood pressure, and she says, as far as I've read, it's the only condition that limits to the one-time 3-month medical. I'm not sure if that's completely accurate, but 391.43 is where you'll find the regulation about the 3-month medical.
Well, I know that if someone came in after 3 months and still had high sugar, we still wouldn't qualify them. And actually, they would be temporarily disqualified. They wouldn't even get a 90-day card.
They wouldn't get even a 90-day card.
No.
Yeah. So here's a question. Will a driver with high blood pressure ever be able to get a 2-year card?
That's an excellent question. That is an excellent question. Now, let's talk about this. And I've had actually several drivers, not a lot, maybe a handful of drivers that came in, who were diagnosed with hypertension. And let me rephrase this. This is not the majority. This is a supra-minority. That they come in, diagnosed with hypertension, maybe get a 1-year card. They come back the next year. They've either controlled it by diet, okay? The diet basically brings the amount down below the normal 140/90. And usually what I do is if they're on no medications, if it's just a diet type situation that they're dealing with, here's what I usually tell them. At the end of the 2nd year, because of stipulations, they have had a diagnosis of hypertension. At the end of the 2nd year, if you go to your doctor and you're still under in the normal range and you have not been on any medications, and you get a letter from your doctor stating he has been monitored, treated, diagnosed under my supervision for the past 2 years with no medication, has been controlled by diet, I feel the driver is safe to operate a CMV, through the DOT policy, I'll give them a 2-year card. I've only had, so far I haven't had any because I haven't been there 2 years yet. Gotcha. So if you have a diagnosis, of hypertension on medication, you will always get a 1-year card.
Interesting. Okay, great. Here's another question. How come we've never heard of a driver being tested that didn't need a CPAP? It seems to be 100% fail rate.
And that's a very, very good question too. And I would have said the same thing too, except I had a 430-pound man come in one time, 6'3". Of course, his BMI was up, his neck size was up, his Mallampati class was a 4. He did not have hypertension. Did the sleep apnea study. No sleep apnea. Some of the guys that do come in, and which I've seen a lot, they actually request the examination or the test because they have a family history of it. I've had guys who are 5'5", 5'7", 150 pounds. They don't follow the regulations of the BMI, the neck size, maybe a Mallampati class, and they are classified as having sleep apnea. I'd say a good 80 to 85%, will be probably closer to 90, from the drivers that fill out that stop bank questionnaire when we refer them over. About 90% of them do have sleep apnea.
Thank you. Awesome. Here's another question, and would wearing a Fitbit, now I'm not sure what that is, that tracks sleep patterns, be helpful in determining if someone may have sleep apnea? Are you familiar with a Fitbit?
Yes, I am. I love the Fitbit. I think it's a wonderful tool to help you with your general health, to help you with understanding if you're a type person that really enjoys being healthy. But the only true definitive test to determine if you have sleep apnea is a sleep study. There are certain classifications, and I don't know the exact classifications, but it does have to be a sleep study where it does check breathing, your heart rate, and it has to be it could be the electrodes that are connected to the head themselves, because they need to check the neural pathways.
Right. Okay. Great. Another question. Generally, who ends up paying for the sleep study if the candidate has no or little insurance? Do you see many trucking firms paying for the test and or subsequent care, such as for the CPAP machine?
In my situation that I'm working with the other companies, I don't see I don't see that particular aspect of the test itself. I'm just asked, are they a candidate for the sleep study? Normally, in some of the companies I work with, they do pay for the sleep study itself, but they do require the driver over a period of 1 year, and they usually they take $25 out of his check a week to pay for the sleep study machine. But here's the thing: if they do have sleep apnea, it is required by the DOT, if there's a diagnosis of sleep apnea, that they have to have a CPAP machine, and they have to use it 70% at 4 hours or more, and they get a 1-year card.
Okay. Here's a question that I've wondered about myself. Says, how is BMI still a good way to reference someone's health? I'm 6'4", 250 pounds, in great shape, exercise regularly, but the BMI says I'm overweight. Can you please explain?
This is a question not just for him and you, but also me. The BMI, the body mass index, was invented many years ago, before processed foods and all sorts of things, when people didn't weigh as much of the situation. But they've kept it going. They've kept it updated. Well, not too much updated, but they've kept it regulated per se. Normally, when I look at a driver, I will look at height, weight. I look at the BMI. I also notate his muscle mass versus his fat, and I'll also notate his age. And of course, there's classifications of normal, overweight, obesely overweight, morbidly overweight. And so, when we're looking at the overweight, it's kind of a situation where, well, what happens if I'm a bodybuilder and I have a lot of muscle mass? So it has to be taken on in each individual type situation. I mean, you can be 6'4", 250 pounds, and have a very small body frame and have more body fat itself, or you could be just a, Mr. Amazing America.
Right.
But your BMI is going to stay the same number.
Okay. All right. Well, so I think we got time for one more quick question, and there are other questions that have not been answered. So those of you in the audience, we're running out of time, but we do have the questions, and we will follow up with you to get them answered. So one last question about sleep apnea is, what about the drivers that are not overweight that have sleep apnea? How does that get caught and treated during a DOT physical?
That's a very good question, and it's kind of a difficult question to answer. A lot of times the biggest things I see is it's usually a spouse, or it's a significant other, or a trainer, or someone hears them, and knowing that they actually stop breathing, because a lot of times the snoring itself is not a precursor to sleep apnea. myself, I did a sleep study about 10 years ago because my wife told me I snored too much, and if I didn't get a sleep study, then I wasn't going to sleep with her anymore. So I had to get a sleep study. Out that I did not have sleep apnea.
Yeah.
So the whole situation of how you know, it's a hard situation. Someone who's coming in, a driver's coming in, he wants his car signed. He's not going to tell you that he's got a family history of sleep apnea. He's not going to say, well, his parents or grandparents or anything like that. It's kind of a, we have our stop bank questionnaire. We have our questionnaire for that. So you really can't, you really don't know. I don't know of a good way that we can find that out.
Yeah, that's a challenging question.
Yeah, very challenging.
Yeah. Well, listen, everyone, we've come to the end of our hour here, and I get the sense that we probably need to have another webinar just to answer more questions.
Absolutely.
And I may try to arrange to do that, but we will try to get back with you and answer any of the questions here that we didn't get to. Dr. Shirley, I really truly appreciate you being on today. This was fantastic information, and
thank you, Steve. Thank you.
Everyone generally got some really good feedback on some questions that we've all had about this these DOT physicals. So thank you very much.
Thank you.
And I'll say lastly, thanks to everyone that joined us today. We hope you got some of your questions answered, and we'll hope that you'll all join us on our next webinar. So once again, Dr. Shirley, thank you, and thanks to everyone that joined us today.